The challenge in US healthcare is not from a middle office, front office, back office perspective. The bigger value, the greater value that AI delivers to healthcare is intelligence. How can a CEO or a practice manager have visibility or intelligence of their practice? I believe that AI is playing a very significant part in integrating and providing intelligence from a physician perspective, from a patient perspective, and from a practice manager or from a business perspective.
Welcome, everyone. We're glad to have our CEO, Mr. Jacob Julian, who's been a pioneer in healthcare services with us today. Jacob, welcome.
Thank you so much, Sandeep. It's a privilege to spend this time with you. You being an expert technology provider, a technology expert in the healthcare system. So it's indeed a privilege. Thank you.
I'm sure we'll have a great conversation, Jacob. Absolutely. In Flatworld, healthcare has been one of the first services, and it's one of the oldest, and arguably where we have deep expertise. So I want to ask you this question. What is your take on the role of AI in healthcare, and where you see the industry move?
Great question. Yes, definitely. US healthcare especially has been our focus for many, many years. And if you look at it from a healthcare service provider perspective, everything was centered around human beings, labor. That was the focus. Now, we cannot escape the reality of AI, and AI leveraged automation in today's world. AI has been there for over 20 years. But since 2022, the commonality of AI has been defragmented, which is a great opportunity, which is a massive opportunity, especially in the healthcare space. It is very transformative. But the challenge is going to be, where we need to be careful is we don't apply the same paradigm of labor in the AI context. Automation can be seen from a human perspective. But I believe that in healthcare, the way at Flatworld, we are seeing for the past few years is visibility. Now, when I say visibility, if you know this better, the number of systems, disparate systems that we have in healthcare is so many. The front office system, the EHR, the billing system, the payment system, and none of these systems talk to one another, which becomes a big challenge from a C-suite perspective, from a board perspective, from a practice management perspective. And when I say visibility, I define that as intelligence. Wow. How can a CEO or a practice manager have visibility or intelligence of their practice? I believe that AI is playing a very significant part in integrating and providing intelligence from a physician perspective, from a patient perspective, and from a practice manager or from a business perspective, from a commercial perspective. I think that is going to be the key. That the focus is not so much on labor automation, but more go to the next level of how do we leverage AI in ensuring that intelligence is provided by integrating systems and bringing out intelligence for the practice, which would result in better health outcomes. I believe that AI-driven intelligence will drive better health outcomes.
Interesting you put it that way.